As the risk of serious illness from COVID-19 increases with age, senior citizens are continuously encouraged to get vaccinated. But how can aging adults further improve their health and immune system post-vaccination? Joining us now to talk more about that is Dr. Jose Rodolfo Dimaano Jr. He's the Medical Affairs Director for the Asia Pacific of Healthcare leader Abbott. Good morning, Dr. Dimaano. Thanks for joining us. First of all, let's talk about the current COVID-19 vaccine situation among the elderly. Let's talk about some facts and figures, percentages. The World Health Organization is calling on the government to speed up and prioritize the vaccination of seniors. What do you know about some of the percentages, facts and figures that we are on?
Okay, good morning, Paula. So right now, we still have about 2.5 million senior citizens who are still not vaccinated. So it's very important for them to prepare themselves for vaccination through nutrition.
All right, after vaccination, Doc, it's also equally important to maintain a healthy and well-balanced lifestyle. The vaccination is just the first step that really sort of gives you the kind of immunity you're looking for. But how do we maintain good health so that we can keep that immunity high? You guys at Abbott are all for investing in proper nutrition and regular exercise. Do tell us a little bit more about the importance of these two pillars or tenets, especially, alam mo naman, sa mga senior citizens natin.
Yeah, that's correct. While waiting for vaccination, and even for those who are vaccinated, there are a lot of things that the senior citizens can do to prepare for vaccination and to maintain their strength, their energy, and to support their immune system. So one of them is really proper nutrition, and the other one is physical activity, such as strength and resistance training. For the proper nutrition part, it has to be a complete and balanced nutrition, especially the ones high in protein, because Filipino diet is actually inadequate for protein, especially for the adults. I think it's like 10 grams per day deficit. There's a deficit of about 10 grams per day on the average for the senior citizens among Filipinos. That's why they have to up their protein intake coming from their natural food intake, and also possibly from oral nutrition supplements containing these proteins, and also specialized nutrients such as HMB, preserved muscle mass. On the other hand, there is also the thing called physical exercise, particularly strength and resistance training, in order to build and preserve muscle, and also to strengthen physical strength. It is important because the muscles are like a bank. We deposit nutrients in them because they provide the building blocks so that your immune system can remain healthy and strong. They provide the amino acids and the proteins so that the immune system cells can multiply by providing building blocks to mRNA and DNA, and at the same time to produce more antibodies to fight off infections such as viruses, such as the COVID-19 virus.
Right. I think you've definitely hit the nail on the head there. And there is a very strong link, or a very direct link, between maintaining your muscle mass and muscle condition and how that affects your immunity. When we let that sort of, when we don't take care of our muscles and the diet that fuels our muscle growth and recovery, you also put your immunity at a little bit of a deficiency. So let's focus on the diet part, because we know as we grow older, there are certain foods that we aren't supposed to be quite as indulgent in, but we know that we need to keep our protein levels high. We need to keep hitting those levels of the proper branched chain amino acids to really sort of trigger, like I said, good muscle health, which in turn is a very important part of maintaining your high levels of immunity. What should we be eating, and what should we be looking at to really up our nutritional balance?
Yeah, that's a good question, Paula. So there are two general types of nutrients, the macronutrients and the micronutrients. First, let's talk about the macronutrients. They are the proteins, fats, and carbohydrates. And these usually provide energy. But the most important among these for older adults, so that they can strengthen their immune system and preserve muscle mass, which is very much linked with the strength or the health of the immune system, is protein. So they have to increase their protein intake, and these can be taken from lean meats, fish. If they are eating plant-based diets, from beans, from legumes, and tofu. Those are the possible sources of protein. Then you also have to look at their micronutrient intake. When you talk about micronutrient, we're talking about vitamins, minerals, Vitamins A, C, D, E, zinc, and selenium are very much known to support the immune system. So they can make the cells healthier and more effective in fighting off infections. Now, the problem is a lot of the older adults also have problems with eating. They don't take as much, probably they have lost appetite and they're not just taking in a lot of the food that they're supposed to take. So in that case, oral nutritional supplements, which provide complete balanced nutrition, and all of these nutrients that I mentioned earlier can help. Specialized nutrients such as HMB can also help in preserving, maintaining, and increasing muscle mass. And muscle mass is important because, as I said earlier, it is a reservoir for amino acids and proteins so that the body, the immune system, can get it from these muscles. The supply of amino acids is building blocks for antibodies and to build and to produce more immune system cells.
Well, there you go. Watch out for your health. Make sure you get enough exercise and make sure that you are eating well. Thank you so much for joining us. That was Dr. Jose Rodolfo Dimaano Jr. from Abbott.